Welcome DSPs. My name is Julie Cramey. I'm a researcher at the Institute on Community Integration at the University of Minnesota and a co-editor of Frontline Initiative.
And I'm the other co-editor with Julie. My name is Chet Cheddar and I'm an education specialist at the University of Minnesota's Institute on Community Integration. We're really excited to have our guests here today, Dr. Ruth Lynfield and Tammy Hale from the Minnesota Department of Health. They're going to share a lot of great information with us today. And we're just going to go ahead and get started. Dr. Ruth Lynfield, very formal I'm being right now. Would you please tell us about your role at the Minnesota Department of Health and how the COVID-19 pandemic has really impacted your work?
Yes, absolutely. Thank you, Chet. First, I want to start by thanking all of you for your work, particularly over the past 20 months. This has been a very challenging time, and your work has never been more important. I'm the state epidemiologist and medical director at the Minnesota Department of Health and have worked at MDH for more than 24 years in a variety of areas, but mostly on the epidemiology, prevention, and control of infectious diseases and other emerging health threats. Over the past 20 months, I have devoted almost all of my time to responding to the COVID-19 pandemic. There's been so much that we have learned about this new virus and new disease and how to prevent and control infection. We have worked hard together with partners in public health, clinicians, and communities to try to limit the spread of the virus and curb its impact.
My name is Tammy Hale, and I am the Infection Control Assessment and Response, also known as ICAR Unit Supervisor. So I've been in my role at MDH since early 2016, and our team has always historically provided infection prevention and control support to a variety of healthcare settings. So typically we answer emails, phone calls, and we also provided on-site assistance where we would go into facilities and actually see what was occurring to make recommendations to improve their infection prevention and control programs. So naturally, our team has been very involved during the COVID response and the COVID pandemic. So our team is extremely busy right now as cases here in Minnesota are quite high. So we are still continuing to answer lots of phone calls, emails, and our team is also going on site for facilities that are having outbreaks or proactively, which means before an outbreak occurs, just to see how they can better prepare.
It's so important to have clear information and clear knowledge about how to respond to the COVID-19 pandemic. And we're so thankful for that kind of information coming from clear sources, reputable sources. And our first question that we'd like to talk about today is really that notion of public health. What is public health and why is it important?
Public health is the science of protecting and improving the health of people in their communities. We use epidemiology to understand what is causing disease and evaluate how to prevent and control disease. We provide guidance and we refine the guidance based on data. The mission at the Minnesota Department of Health is protecting, maintaining, and improving the health of all Minnesotans. And this guides all of our work. I can talk a little bit about what the work of public health is, and that is to prevent health issues and problems from happening in populations and communities. The scope is wide and includes clean water, healthy food, safe homes, and control of contagious diseases, among many areas. The work is done through studies, recommending policies, educating people, and providing services. We work with partners to promote health and prevent disease. And speaking of partners, we are so honored again to be part of this frontline initiative because each of you is an important public health partner. Your work in promoting health is critical and appreciated. Public health is also involved in understanding and working to narrow health disparities. The COVID-19 pandemic magnified many health disparities. We all need to work together to improve the health of our communities. This will take partnerships and collaborations across disciplines and people, but will result in more resilient and healthier communities, and it will benefit all of us.